Hello, and thank you for joining us for this MD Magazine peer exchange on updating best practices in the diagnosis and treatment of Clostridium difficile infections. Clostridium difficile is a common cause of infectious diarrhea. It's associated with a substantial clinical and economic burden across the entire spectrum of healthcare. Advances in understanding the optimal diagnosis and management of C. diff infections over the past several years led to notable clinical practice guidelines revisions in the 2017 recommendations. Well, this MD Magazine peer exchange panel of experts is going to walk through some of the most significant guidelines changes, and we're going to discuss how they translate to what you should do differently in everyday clinical practice. I'm Dr. Peter Salgo. I'm a professor of medicine and anesthesiology at Columbia University College of Physicians and Surgeons. I'm associate director of surgical intensive care at New York Presbyterian Hospital. I see far too much C. diff, gentlemen, so let's figure out how to deal with this stuff. Joining me for this discussion are Dr. Darrell Gerding, a research physician at the Edward Hines Jr. Veterans Administration Hospital of Hines, Illinois. Dr. Yoav Golan, an attending physician from Tufts Medical Center in Boston, Massachusetts. And Dr. Darrell Pardi, professor of medicine and vice chair of the Division of Gastroenterology and Hepatology at the Mayo Clinic College of Medicine and associate dean of the Mayo School of Graduate Medical Education in Rochester, Minnesota. I want to thank all of you for joining us. Let's get going over here. I guess that the basic things are basic. Why don't we start with C. diff itself? What do clinicians look for? How does it present?
Well, thanks for the question. It's a pleasure to be here.
You're more than welcome.
So I think it's important for us to realize that C. diff can present in both systemic symptoms and localized gastrointestinal symptoms, and obviously the main symptom of C. diff is diarrhea. And I think it is important to remember that diarrhea is defined not just by consistency of the stool, but also the frequency of the stool. And you need to have enough diarrhea to be considered as someone who has C. diff. So at least 3 episodes, if not more, of loose stools a day. You can also have some cramps, obviously, and even belly pain.
But you know, I get this question all the time, which is, my gosh, this patient has had 82 different antibiotics, and he's getting cramps, or she. The white count's 50,000, but there's no stool. Is this C. diff? I mean, based on your definition, it's not.
Well, you have to have diarrhea in order to have C. diff, unless you have such severe C. diff that you have complete ileus. And in this case, you may not have any bowel movements. But in this case, people are usually very, very sick and have many other symptoms.
So that's not a secret anymore.
And so I would say that if you have no diarrhea, absolutely no diarrhea, and you're not very sick and have ileus, then you probably don't have C. diff.
So if you go to the nurse, as we often do, and say, what does the stool sample show? Because we think it's C. diff. And the nurse says, I haven't got any stool. That's not C. diff?
It could be C. diff, but
I knew you were going to say that. Thanks for clarity.
The high white count is really the key differentiator of someone like that. And when you have an unexplained very high leukocytosis, that may be a reason enough to look for C. diff.
Okay, but the white count of 50,000, but he said if there's no diarrhea, this can't be C. diff.
He didn't say that.
Well, then tell me what he said.
Well, he said there's an exception to that, and that is when patients have a high leukocytosis and have what's called an adynamic ileus, so that they aren't moving their bowels, then they can have C. diff. In fact, they might be even at greater risk of mortality when they aren't passing stool in that setting.
That's where I was going. I mean, not every C. diff patient is going to present with explosive diarrhea right in front of you.
But I think it's very important to emphasize the point that both Yoav and Dale have made, which is if you don't have diarrhea and you have C. diff, you should be very sick.
Okay, so somebody who doesn't look sick, has a white count, but has no diarrhea is less likely. By the time they get to that non-diarrheal stage, they are, to use a phrase we use, sick as dirt. And that's different.
Well, if you look at the guidelines that we'll discuss later, this is one of the defining symptoms of actually a very severe episode of what we used to call severe complicated. So that's right.